Hi, I'm Dr. Aman Fauzi Kasim, Resident Consultant General Orthopedic and Arthropathy Surgeon from Sunway Medical Center, Penang. A patient came to me complaining of both knee pain. She's unable to walk long distance and the knees were bent forwards. She has tried medications elsewhere, but the pain is still unresolved. End-stage osteoarthritis is a degenerative process which is due to wear and tear of the joint cartilage. In her case, this is also contributed by her body weight. Her condition has severely impacted her daily life. It is difficult for her to manage her daily activities and difficult for her to do any traveling to fulfill her job requirement. The treatment for osteoarthritis is usually depends on the stages of osteoarthritis. But for end-stage osteoarthritis, surgery or knee replacement is the gold standard of treatment for end-stage osteoarthritis. The patient has actually tried other methods of treatment, but they didn't help with her knee pain. As her case is end-stage osteoarthritis, a total knee replacement is the best treatment that would help her with her knee pain. In conventional TKR, the surgeon will do the surgery and perform all the bone cut. Whereas in the robotic TKR, the surgeon will still do the surgery, but with the help of a robot, it will improve the accuracy of the bone cut and the placement of the implants. As the patient requires a fast return to her activities and a return to work, so a robotic TKR was suggested for this patient because using a robot, this will allow the patient a faster return to activities, a more personalized surgery for the patient, a more accurate placement of the implant, a faster recovery, and a smaller skin incision that will allow patient to return to her daily activities faster and easier. In the image-based robotic TKR, a CT scan will be obtained before the surgery, and this will be used to determine the correct size of the implant. And during surgery, this will be used to be placed and to confirm the position of the implant during the surgery. In the imageless robotic, anatomy of the bone will be mapped out during the surgery, and this will also be used to determine the size and the correct position of the implant. Compared to a conventional TKR, this patient's recovery is much faster. She has less pain post-operatively, and she's able to stand and walk in her room on day 1 post-surgery. On day 1 post-surgery, she has already been started on physiotherapy. She's able to stand and walk in her room and during the physio session. As soon as her wound heals, around 2 weeks, she is allowed to do more walking and to do more bending of her knees. She can climb out a few stairs. I can say that her quality of life has much improved after the surgery. She is now has relief from her knee pain and not dependent on painkillers anymore. She is now able to walk a longer distance, able to climb up and down stairs easier. So managing her daily activities is much more easier for her now. The main key factors that can contribute are mainly the patient, the surgery, and the physiotherapy. In terms of patient, the patient needs to be motivated to undergo the surgery. In terms of the surgery, you want a correct sizing and accurate implantation of the TKR implants and a very optimal soft tissue release. In terms of physiotherapy, which is very important, you need a good physiotherapist to provide you the physiotherapy session so that patient can return to their activities easier and faster. As a recent study have shown the benefits of a robotic TKR in terms of a faster recovery and less pain from the surgery, I would like to recommend robotic TKR for those patients that needs a knee replacement.